Hi guys, so I am back with another video today. In my last vlog, I believe I had told you guys that I was going to react to one of my old, what do I call it? Like my rotation videos. So I have a couple of them to choose from. I have my computer in front of me and I will be listening to the video with my headphones on. I'm going to choose the one that has the most views, which is my first one. I would figure that it would have been either my last one or one of the ones that I was like most experienced as a student, but no, it's my first one. So that's gonna be a little strange because I definitely don't remember much about this video, and I filmed it over 3 years ago. So now I've been working for almost 2 years, which is kind of crazy to say because I still feel like a very, very new provider, but I do have some experience under my belt at this point. So if you guys didn't know, I was a PA student a couple years back, and I did this series on my channel so that I could kind of give my 2 cents on my rotations. One, to remember for my own sake, but then I also wanted other people to have a reference to understand what these rotations were kind of like and what to expect. So it was half for me and half for you guys. I wanted you guys to kind of have a guide, and then I just wanted to remember all of these things. I'm imagining that once I start watching the video, I'll remember some of the stuff that I'm talking about. So let's get started. And if you guys are interested in watching the rest of the series, I have a whole playlist and I'll link it down below so that you guys can watch all of them if you want to. This video is 16 minutes long, so it's quite long, guys. All right, let's go. Whoa. I look like a baby.
My name is Brittany. I am currently a clinical year PA student going on rotations, and today's video is going to be a summary of my emergency medicine rotation. I'm going to go through basically
what I really liked is the way that I laid out the video, and I did those like emergency med rotation inserts. I think it made it look really clean, and that's something that I miss with a lot of the videos that I make.
At the hospital that I was at, every single week we would have a different color, and that would mean that we are going to different sections of the hospital in the ED.
I do remember the schedule. My first week there, I was in critical care, and it was by far the scariest thing I've ever seen. Like, people were coming in with trauma. They were coming in with Lucas machines attached to them because they, I distinctly remember this. One of the patients who I was helping to ambubag had choked on a piece of steak, and they were doing chest compressions because he had literally choked, wasn't breathing at that point. And I was in the room when they did the chest x-ray. I didn't know that I had to leave, and it was like because I was the person who was still bagging him. So it was just like, I remember that week was so chaotic. I did like blue, which was fast track, and that's a lot of like quick suturing, staples, things that people can come in and out for very quickly in the ER. Red, purple, and gold were very similar, and then there was pink, which is pediatrics. You don't get to do much. A lot of the pediatric patients are coming with croup or strep throat, things of that nature. And when I was doing my emergency medicine rotation, I think it was not quite flu season, but maybe like September. So a little earlier than flu season, but there were still a lot of kids that were coming in sick with a lot of viral illnesses.
So my first day was a lot, and even the first week, because I was put into critical care and these patients come in extremely sick. And here I am, a first like rotation PA student, literally does not even know where the bathroom is, and I
can't even believe I just said that I didn't know where the bathroom is. But that is generally so true and honest of me because no one knows. If it's your first time in that hospital, your first time in that ER, you're not going to know where anything is. You don't know where the closets are, the rooms, like literally you're looking for the patient's room and you don't even know where they are. So it was just funny that I said I had no idea where the bathroom was because it's just so true.
After the first week, I moved into fast track, and this was where I really liked it because here I got to do a lot more procedures. A lot of the things that I saw were dog bites, animal bites, and also like lacerations. So I remember this guy came because he stepped on something at the beach and he had this huge cut on his foot.
Oh, I remember that. The cut was so deep you could see the veins in his, like in the bottom of his foot, which was crazy because I did not know that, you know, like there was so much tissue on the base of your foot. Okay, so this is what I remember from this rotation, and it ties into a little bit about ID. So like I said, this guy came in, he was at the beach, stepped on something in the water, came out with this huge gash on the bottom of his foot, like to the point where maybe half of his heel was off of his actual foot, and we had to basically suture it back together, so sew it back with stitches. And I remember the resident telling me that because he had got this injury in fresh water, which is either a body of water like the ocean or a lake or a pond or something like that, in addition to covering for skin flora, which is like strep and staph, you also want to cover for something called Vibrio. And specifically it's Vibrio vulnifericus, and it's because this bacteria lives in the water, and when you get this, it can cause a skin infection, but if it gets systemic, it can also cause diarrhea or other severe things. And if it's in a wound, you could have an infection so bad that you need to amputate that wound. So like I was saying, in addition to staph and strep that you want to cover, which is the gram positives, Vibrio is a gram negative, and you want to give doxycycline for that. So that was specifically something I remember from this rotation.
During my second week, I remember still going in to see the patients with a provider because I didn't really know what to expect in terms of interviewing a patient on my own. There are certain parts of the medical interview that you leave out and parts that you want to hit in order to tailor it to what the patient's coming in for.
Okay, so this part is very true, where as a provider now, after I've been working for a little bit, I kind of know and expect myself to know what questions I want to ask this patient. So if they're coming in with a specific infection, let's say infective endocarditis, the things that I'm going to be looking for are not so specific to, are you having knee pain? Are you having hip pain, right? Those are things that I would ask if someone had a prosthetic joint infection in those joints. But for someone with infective endocarditis, it's a little bit different. As a provider, I think with time, you kind of learn what you want to ask your patients. And then as a student, you walk in there with just a blank slate and you don't know what the heck to say. But I can remember just distinctly how scared I was to walk into these rooms. And now I'm not so scared, but I do still have some of that imposter syndrome where I'm like, do I really know what I am getting myself into when I walk into this room?
My fifth week is when I was in purple, and here I also saw a patient who was of higher acuity, which means that they were a little bit more sick, and I was able to help them. I was able to present to the fellow that I was working with, and we got her into the OR in a good amount of time. And I think that was also another confidence booster for me because I was able to recognize that this patient was ill and they needed to be seen and consulted with someone else right away. And I think that's very important as a student. It's to know when you're stepping into a room if that patient is, number one, sick or not sick, and then also if they need emergent care.
I remember this. So this, I just got to the to the floor or to the ER, and it was the first patient that I was gonna go see. She was pretty young. I want to say she was in her 30s maybe, complaining of abdominal pain, just like diffuse. It had come a couple days ago, then went away, and then came back with a vengeance, and it was just hurting her so bad. I asked her a couple questions. Her husband was in the room. I think the biggest thing that I remember asking was like, when was your last menstrual cycle? And she was like, I don't know, maybe like a month ago. And then that was like, ding, ding, ding. Is there any possibility that you could be pregnant? And she was like, there might be. So with her saying that and me doing my physical exam, most of her tenderness was in the lower abdominal region. And so anytime you think about an ectopic pregnancy, you also want to get a beta HCG. That's going to measure for that pregnancy, basically hormone level. When that came back positive, we consulted OB. And I remember I had gone out, presented to the resident, or actually he was a fellow. I presented to the fellow and told him like, this is everything that I want to order. Literally as he was putting in the orders, he was like, I like this idea. We're going to do this and this. And then as that's happening, the nurses are like running into her room with a crash cart because I think she had momentarily passed out from the pain. That was extremely scary, but I do remember the story, and I do remember me working with the fellow and being very hands-on with her care, and I really liked that he listened to me and kind of told me like, I agree, we're gonna do that. And I do remember this moment very, very vividly, which is crazy because like I said, this was 3 years ago.
So that's a summary of all my 6 weeks and what I did, what I tried to focus on. Now I'm going to talk about a little bit more of how my everyday schedule went. So every day I would work with a different attending / resident or PA, and being an introvert, I think that really drained my social battery. I had 3 shifts a week that were all 12 hours. Sometimes I would stay for a little bit longer if I was seeing a patient. But other than that, I was there for pretty much 12 hours a day. And I would eat before I got there and then eat once at the hospital just because I didn't want to come home so late and eat.
Okay, if I remember correctly, my shifts, like I said, there were 12 hours. So if I went in at 9 a.m., then I would leave around 9 p.m. sometimes a little bit later. So I was there for basically the whole day. I would go in with sunlight outside and then leave and it was dark. What I'm saying is like, I'll eat before I get there. So I probably ate breakfast at home and then had lunch / dinner. So it was whenever I got hungry and I had time, I would go eat. So basically during my emergency medicine rotation, I only ate twice a day. Some people can be sustained off of that. I personally need to eat 3 meals or else I get really hangry. So I don't think that this eating schedule worked for me, but that's what I had to do when I was on this rotation.
I would say that out of a 5, my emergency rotation was probably a 4 out of 5.
I do remember just how I felt after that rotation. So I like, even now I would still give it a 4 out of 5 after going through all my rotations. And at this point when I'm filming this video, like I have no other rotations to compare to, but I still today would give it a 4 out of 5. I think that's pretty much the end of this video. I hope you guys enjoyed the small commentary and the small things that I could tell you a little bit more about when I had this rotation. It's just crazy how much I've experienced as a person who's worked for now almost 2 years, plus whatever experience I had in the hospital as a student. But genuinely, I have so much respect for the people that work in the emergency room. They deal with so much. I could not do it. And I found this video to be really insightful. So if you guys want to watch my other rotation videos, definitely give them a watch. I have emergency med, OBGYN, psychiatry, pediatrics, internal medicine, family medicine, infectious disease, which is now my job, and surgery. So 7 or actually 8 videos that you guys can go watch if you like what you saw today. And I will see you guys in my next video. Hopefully it will be another sit down one. If not, it will be a vlog, but I'm trying to upload more regularly. So if you guys like this schedule, let me know what you guys want to see, and I will see you guys in my next video. Bye.